Very warm welcome to this episode of Male Fertility Series. I'm Dr. Colin Teo. Well, male subfertility constitutes about 40 to 60% in any subfertile couple. Common conditions that we see usually may come across as what we call large veins or varicocele. It's easily diagnosed on ultrasound scans, or it can be examined by your doctor. But patients, do they present with varicocele? They don't come and tell us that. So normally they may come with a test already showing that there's low sperm count or abnormal shapes in the sperm. And some of them don't even have any sperm in the semen. So commonly then we have to examine them. And then some of them even find that they have sexual dysfunction that is affecting their fertility, and solving that solves the problem. Not common, but sometimes we do find that genetic causes are reasons why some males have subfertility, and then we can actually do tests to also examine that. General state of health matters a lot. So if a man exercises, eats well, sleeps well, he has set the stage for a good fertile ability in any man. But let's say you're always falling sick, you're always sleeping like very short hours, you're getting the flu all the time, you do a semen analysis, you will find that sperm quality drops. But other than that, well, if you have chronic diseases or you have even this condition called testosterone deficiency, then you possibly may have some issues. Well, signs and symptoms of male subfertility. Well, we define subfertility as after a couple had tried for a year with frequent intercourse and they have no children. That would be a red flag and a signal to say maybe they have subfertility. Um, what can we notice? Well, sometimes the semen may be different in males. They find that it's too thin or too little. So that would suggest that there could be issues. And if you're able to see testes that are missing, swollen, too big, or even abnormal enlarged veins, we call them varicoceles in the scrotum, these are signs that suggest there could be subfertility. And we look at the overall development of the male. If the male is not well developed, it could suggest that certain hormonal issues could be present, and then that may also then contribute to subfertility. So these are potential signs or signals that suggest subfertility. Yeah. Well, most of my patients will ask me actually, is their sperm normal? How do you know? They may describe the color, the consistency, and then how often they have sex and whether is it normal. Simple way to just do a simple semen analysis that tells us the number of sperm, the quality of the sperm, and its related health sites, whether there's infection, suggestions along those lines. So a simple semen analysis can be done, and it's a pretty straightforward test. Right. So in a semen analysis, first the volume of the semen is being measured, and any volume that is too low, less than 2 mils, will probably indicate some issues. Other than that, then we look at the sperm quality. The sperm count matters a lot. Occasionally, men with subfertility receive zero sperm. We call it azoospermia. Technical term, but it just means there's no sperm seen at all. That's definitely not normal. But sometimes the sperm may have a lower number. And we talk numbers in sperm, we're talking about millions, millions and millions of sperm. The other thing we look at would be motility, which is how the sperm swim. Sperm swimming forward is important, either very happily swimming forward or being sluggish. And the more sperms you can swim forward, the better it is for the chance it is for the sperm to actually reach the egg. And of course, the morphology, which is the shape of the sperm. You can get sperms with abnormal tails, abnormal bodies, or abnormal head. When the head's abnormal, even if the sperm swims like the Olympic swimmer, when it reaches the egg, it cannot penetrate the egg, and that makes it like pretty much a pointless swim. So the shape matters, and sometimes look at the insides of the sperm to look at the DNA fragmentation. And well, we can always say that the taxi may be great. It drives all the way to the hotel, and then we open the door. There's nothing really exciting inside, so that's also quite pointless. So semen analysis and also studying what's inside what we call the DNA fragmentation gives a good clue how healthy the sperm is and the semen. So semen analysis looks at the outside part of the sperm, where we look at the shape, has it got a nice head, and then you look at the tail where it swims very well. That helps in the motility and the swimming of the sperm to reach the egg. But importantly, is a good sperm is one that can swim well, swim forward, and be able to penetrate the egg. So a sperm is essentially a taxi. Now then, but what really matters is what the sperm carries, because that is what uh, that really goes into the egg, and then that's where fertilization takes place. So DNA fragmentation looks at the health of that package being carried. So the more the DNA is fragmented, the more unhealthy it is, or more unlikely it is that there can be good, healthy fertilization. So the two tests are actually looking at the sperm, but one looks at the outside and the other one looks at what's inside. So really the question is, why just do semen analysis, or why do semen analysis without a DNA fragmentation test, and who does what? The truth is, it does depend on the practice of the very doctor you're seeing. Some doctors only look at semen analysis, some will look at both. There is a price difference. The simple semen analysis costs just below $100, thereabouts. Whereas if you were to actually add the DNA fragmentation or the DNA studies to the test, it will be about 3 times the cost. So different doctors will look at different parameters, but uh, I tend to look at both. I look at both the semen analysis and I also look at the DNA fragmentation index. But again, it does depend on also what the patient prefers. Some wouldn't want to spend so much. So, well, so why do we do DFI, or that's a short form for DNA fragmentation index? Well, certain treatment, even with supplements, not just medicine, does see an improvement in the DFI, and there is research, and we are moving towards improving that to increase the fertility of couples. So it actually gives us a reference to actually the health of the sperm itself, and that's why we do it. Now, having said that, DNA fragmentation index testing is very different from DNA testing. There's a different test altogether. Those tests we look at the different chromosomes that may lead to subfertility. So there's a different test. So in DFI and semen analysis, we look purely at the semen itself. Now, semen is actually the total amount of the liquid that comes out in the ejaculate. So what you see flying out, whether it's 2 mils, 5 mils, everything put together, we call it the semen. Sperm actually makes up only about 10% of the entire semen. And sperm are the swimmers, the little swimmers, the tadpoles that we see, and this is produced actually in the testis. The rest of the semen actually comes from the prostate and the seminal vesicle. So that's when you put them together, it's the entire package, so we call it. Well, by and large, even when you talk about anything coming out of the body, whether is it when we go to the toilet to pee, what we eat, what we drink, our state of health matters, and it changes the way things smell and look. So similarly for the semen, depending on what we eat, it can smell differently. It can be also different from the frequency of ejaculation, the consistency, and even the color. It can be different. Sometimes it's mixed with some urine, it looks a bit yellow. Yeah, but infections can also cause it to be different with odor or smell that is fairly unpleasant sometimes. Infection doesn't always have to be STI, but it can be sexually transmitted infection that causes some change. Well, first thing anyone would do is go into the internet and Google, right? Uh, well, yes and no. We can find lots of good stuff on the internet, but then again, lots of stuff are really just for sale and to make a quick buck. So what's good? Well, I would say that speaking to doctors who deal with fertility would be probably one of the best way to move forward because they know the product, they know what's been given, and they know the outcome. And some products or some supplements actually come back by studies. Certain supplements on their own, like lots of vitamin E, lots of zinc. The list is quite endless, and you find yourself buying loads of supplements in different amounts. So we usually find that not to be the best way forward. We tend to prefer to actually give our patients supplements that have studies and have already created the combination or the cocktail needed for fertility. Yeah. So usually we don't recommend self-medication. Uh, well, buying supplements online is not really medication, so usually there are no serious danger. But as with anything, overdosage of even simple vitamin A can give problems. So I would say that the amount you buy is one thing. The other thing is quality assurance. How do you know you're eating what you're buying and what's being stated on the product? So those are the dangers. The other thing is this: sometimes medicine is mixed into supplements, especially traditional sources. I would be very careful about that. And I've had cases where people take testosterone on their own and they order them online. That's not recommended because unbeknownst to many people, while low testosterone can give problems for fertility, if a guy were to take testosterone on his own, tablet version, gel version, injectables, you actually create subfertility. You actually suppress your sperm production to zero, and it takes even up to a year for recovery. So we wouldn't advise self-medication and self-diagnosis and self-treatment because it could be causing a lot more problems for yourself. Well, should you be telling your doctors about your fertility plans, your family planning? Yes, you should. In fact, most of the time when we see patients, we tend to ask basic questions like, "Be married? How many children do you have? Are you still planning to have kids, or have you stopped planning to have kids?" In many cases, certain medicine does have effect on fertility or sexual function. So it's good to tell your doctor whether you're still planning to have family. Uh, Especially again, if I talk about testosterone replacement, uh, some men would go and say, "Okay, doc, I'm feeling tired. I have all the symptoms of testosterone deficiency. My erections are not that great. I need testosterone." And true enough, you may have that problem. Only thing is, if you not completed your family and you take testosterone replacement, then you can end up having zero sperm count, and what you're trying to solve becomes the problem is made worse by this so-called treatment itself because this family uh, planning isn't made known to the doctor. So always tell your doctor whether you're still planning to have children or whether you've completed your family. So what can we really do to help with male subfertility? Well, first we got to diagnose it, so that's important. And then depending on the condition, we are able to help. Well, from a supplement perspective, we can actually recommend the right supplements to take and be able to monitor for whether is there improvement with the supplement or not. And if there are hormonal deficiencies, we can correct it the safe way. And for certain conditions, which is fairly common, varicocele, which are congested veins around the testis that raises the temperature and affects sperm quality, we actually have surgery, microscopic surgery to correct that, which is fairly simple. Day surgery, small little wound, minimal risk, and that actually changes semen quality in a significant number of patients who have varicocele. And for men or couples who are very stressed out when they're trying to have children, men tend to have performance anxiety. It's not uncommon then to find that they have sexual dysfunction. When it comes to that, urologists are, and even GPs are able to help with medicine, whether is it for premature ejaculation, whether is it for erectile dysfunction. All these are actually safely provided for when you see the right doctors. And there's a fair bit that can be done for male subfertility. For those conditions that cannot be corrected, like men who have what we call azoospermia, we cannot get any sperm, we can try to boost the sperm counts with hormonal injections. And sometimes we will have to do surgery or minor procedures to actually extract sperm that is not in the semen but directly from the source. So it's a fair bit we can do. And usually we do all this together with subfertility experts, and because they need the sperm to fertilize the egg. So we tend to work together, and we usually talk to each other closely because it's not just a medical journey, it's highly stressful for the couple. So usually it helps when both the doctors are talking to each other. So a few things that usually come to mind is how fast will I be cured, so to speak? When can I have the baby? I always tell patients, well, fertility side of the house is one important part in a marriage, but the regular sex and intimacy actually shouldn't stop. And even if semen analysis shows a low sperm count, well, the truth is all you need is one good sperm, right? So you never know when a miracle or when that good sperm will actually fertilize the egg. So things can happen anytime. Uh, but generally speaking, it takes about 3 months for a sperm to be produced and to mature for fertility. So whatever we do, whether it's supplements, medications, or surgery, we tend to say that, well, you see the full effects probably in 3 months' time. So we tend not to over test before that, otherwise we're spending lots of money and getting depressed because I'm not seeing results. So we tend to stage out the timing, which is why early planning matters and deciding to do certain procedures matters early. So first thing is get a diagnosis if you're concerned. Second would be don't self-medicate, don't self-treat because you could make things worse. And the third thing is it's not just you going through it, it's actually the lady and you. So as a couple, it's usually a very stressful time. And important is to note that while fertility and trying to produce babies is really important, the intimacy side of the house, the strength of the relationship, the support you have for each other, that's gonna carry you through. So people have problem with performance, you can help with that. Ladies go through the mother of all PMSs when they get hormonal injections. That needs a lot of understanding, but ultimately, if you ask me, it's all worth it. Children are all worth it. Go all out. You want to have kids? Today's technology and medical science allows you a much better chance. And as far as that's concerned, go for it.